All right. Bonus episode for the Last Visit First podcast. I'm honored to welcome a longtime industry leader and innovator, as well as a friend and a mentor of mine, Elliott Wood, the CEO of Medalogix and Forcura. Elliott has been the helm of transformation work in the post-acute care space for many years, from predictive analytics to workflow optimization, helping providers reimagine the care delivered in the home. Now he's leading the next chapter of growth for Medalogix and Forcura, where these two companies are coming together. There's a new identity being launched that represents more than just a merger. It's the vision of the future of post-acute care. Elliott, I'll let you be the one to share the new name and the new logo and tell us the story behind it. Welcome to Last Visit First.
Awesome. Thank you, Tom. Thanks for having me. So glad that this is being recorded so I can play back for you all of the kind things that you just said about me.
Oh, yeah. In the future, I want to hear it. Yeah. Every time we start knocking heads, you'll play this back for me. All right, Elliott. We're here for the reason. What's the reason? What's the new name?
So, Forcura and Medalogix. From this point forward, we will be known as Mosai.
Imagine a healthcare system where every patient can get the treatment they deserve in the place where they feel most comfortable, at home. Now, two industry leaders, Forcura, connected workflow solutions for seamless and efficient management of referrals and orders, and Medalogix, predictive patient insights for timely, truly personalized care, are making that vision a reality. Introducing Mosai. Mosai is the only end-to-end care coordination platform that connects people, processes, and data into one coherent platform. It harnesses intelligent automation that streamlines patient onboarding and accelerates time to care. AI-powered recommendations that enable quick and informed clinical decisions. Secure, real-time communications for closer physician and care team alignment. Empowering providers across the care continuum to deliver the right care in the right place at the right time. Together, we're assembling the scattered pieces of healthcare into a living, breathing mosaic. Together, we're creating a picture of care that's whole, radiant, and true. Together, we're Mosai.
Yeah, so it's been just a great process with the team in terms of taking Forcura, an incredible culture, strong brand that they had as a company, very well-known brand in the industry. Take the Medalogix culture, the Medalogix brand, also very well-known in the industry, but also known for different things. And as we're bringing these two different companies together, really looking for, okay, what is not just a word, but like an identity that would describe what is the new company, new mission, new vision. We went through a ton of names. Most of them are made up words that we were going through. We love this idea and ultimately landed on mosaic. And so this idea that really what this new company is doing and what we are about is pulling together a ton of distinct, disparate information that can be found in all different parts of healthcare and in different systems, and ultimately bring that together into a picture of a patient that can't be created any other way. And so we love this idea of a mosaic because that's what a mosaic is. It's all these different disparate pieces of information or images that come together to create something that is very clear in the aggregate. And so we're excited about it.
Why was now the right time for Medalogix and Forcura to come together under one identity? Tell me the story.
You know, one of the cool things about the industry is it's a relatively small industry. It is an industry where everybody kind of knows everybody. And Craig Mandeville, the founder, CEO of Forcura, and I have known each other for a long time. I've been friends for a long time. Some of that is because we were both trying to do startup technology companies in this space. And then some of it is because of that, we're also dealing with a lot of the same challenges and struggles of building a company at the same time. And so I would say, you know, the first thing was there was just a good relationship here between the two companies, and has been for a long time. And so, you know, years go by, we really start to do work together more on the commercial side, just because in a lot of cases we're working with the same customers. We're trying to create new relationships with new organizations and new customers together. So I would say the first really milestone for our organization was just doing marketing together. And then as time went by and Forcura was enhancing their platform and really taking over the referral management space, Medalogix started to move kind of upstream relative to where we were. And so Medalogix historically had been in clinical analytics space. And when generative AI came around and was made available, we found some use cases in that kind of referral management process and in the admission process that just made a lot of sense for us to go after. And the more work that we did in that space that included referral documentation and information coming in about the patient during that referral process, the more we realized, oh man, we really need to have a relationship, like a formal relationship with Forcura, because our customers, they don't want to upload documents in one system and then upload documents in another system. And so for a variety of reasons, it just made sense to start having a conversation around, hey, how do these products work together and create a better experience for our customers, and, you know, less logins, more automation, more value. And so the coming together of these two companies in a merger was really born out of conversations around how we might partner, really with the belief that, hey, these two platforms between Forcura and Medalogix, they can actually create more value when we're working together and when they're integrated than we can on our own. And so I think a lot of mergers happen, especially in healthcare. I think especially in technology, they're primarily financially driven, and because they make good financial sense. I would say Forcura and Medalogix really came together because we believed we could create a better product together. And so we've already done some initial things that I'm sure we'll talk about here in a little bit. But, you know, what we're finding 7 months into that process, and as we're out talking to customers about how the products work together, it's definitely resonating. I would say key kind of thing, why are these two companies coming together? It's one, because of the products, and because we believe they work better together. And then two, because there was a significant amount of aligned vision around how we can incorporate the information that we're capturing from the customer and capturing from our EMR partners and provide that to clinicians in a way that make their lives easier and ultimately ensure that patients are having an opportunity to stay at home. So I would say product and mission. Yeah.
It's cool. I remember the day that Craig came into Home Care Home Base. I take zero credit for his success, but he came in and he had this cool product, and Guy Constance and I sat down, and I remember Guy going, why are we talking to these people? And I'm like, Guy, because I hate faxing. I don't want to do this faxing thing anymore. We're dealing with all these orders and management, and Citrix made it hard. And let's sit down with Craig. Let's just, please come to this meeting with me. And Craig came in, and I mean, he was literally a startup. I mean, he was a one man. It was him and another guy, I forgot who it was, came in with him, and he started presenting his vision, and guys like, this makes total sense. Why are we not doing this? And so we started building the machine with Forcura. I mean, this was years ago, 2008, 2009. I mean, it's kind of the same story that you and I have at Medalogix, where you guys came into Home Care Home Base and said, hey, we're going to predict, home health to hospice transitions. And I take zero credit for the success of those two companies, but we enabled them to do it, and they were solving a big problem in the industry that everybody needed solved.
Yeah.
And it's cool. It's cool to watch entrepreneurs do what entrepreneurs do.
Yeah, no, I mean, the truth is both companies have had an amazing relationship with Home Care Home Base. And so you can say that you take zero credit for that. You should take a little credit for that.
Maybe.
You know, Home Care Home Base has always had a ton of stuff to work on. But I think, one of the, I would say, in taking myself back, this is almost 11 years now, to those conversations, is in order to do that innovation, and to make it, easy enough for the customers to adopt, especially a new idea. It had to work well with the EMR. It couldn't be a manual thing. It had
That's
to
right.
be connected enough to the EMR that the customer would use it. And frankly, we were just, I think, in the right place in the right time, able to have a great relationship with you and Home Care Home Base in order to make that happen. And then I
Yeah, it was
think,
fun.
the other thing that I think people often need to know about Tom is I don't know anyone in the industry who listens to their customers with more kind of reverence and attention to what the customers need. And so I think, that's a huge testament to you and your vision, 11 years ago in terms of like, hey, you got to listen to the customer, understand what the pain points are, but you also have to have enough vision around what the customer may not be asking for to know, okay, well, this is a problem. And there may just be one customer asking for it today, but in 3 months, 6 months, and a year, you're going to have 10 customers, 15 customers, 20 customers asking for it. And that's, what ultimately happened with our partnership.
Yeah, I'm going to sneak another question in here that I didn't send to you on the list of questions,
Okay.
but I think it's a fun one. So you're an expert at this, right? You've done, and by the way, I was a founder of Muse with Brian Mosier and Jennifer Maxwell, and we merged Muse into Medalogix, I don't know, 5-6 years ago. And that went absolutely phenomenal. I mean, it went great. We didn't miss a hiccup on sales, on product, on strategy, and we enhanced those products. We made Muse even better. Muse has got the highest NPS score of any product I've ever seen in my life. And why, Elliott? Why did that go so easy? I mean, it wasn't me. I got out of the way. Jennifer Maxwell and Brian did all the work, but that went so well. Why do you think that went so well? And then I'll turn that question to, can we take that same playbook and make Forcura and Medalogix, or now Mosai? Can we make that Mosai integration the same way?
Yeah, no, it's a great question. When I think back about the work that we did together with Medalogix and Muse, we had to very early on decide, okay, who are we going to be? How is this company going to work? What are we really trying to accomplish over the next 3 to 5 years? And, every partner that you have wants it to be 3 years, but it's really 5.
Of course. Yeah. Thanks, David Chupin.
And we had to get, I think, and we did get very aligned on what that mission was very quickly. I think when you do that as quickly as we did in this was 2021, from a leadership perspective, from a board perspective, from a financial partner perspective, when you can be in alignment like we were in 2021 and knowing, okay, this is what we have to do and keep it simple, I think it pays off in terms of execution and ensuring that your team who's reporting to the CEO and the C-suite really understands and can operate, that their teams below them have a clear picture of, okay, well, this is the mission. This is ultimately what we're trying to accomplish. I think we did a great job with that in 2021. And in large part, our plan over the course of the next 4 years didn't deviate, I think, at all. I do think we had some hiccups along the way, like any company does. But in general, I think the core part of our plan was a success. And we had the fortune, I think, of one, having a good plan, having a good partner, and then having good execution.
I would also say on that, the board was amazing.
Yeah.
The board that you put together, David Chupin gets a lot of credit for that too, but the board that we put together for Medalogix and Muse, when we put those two companies together, was amazing. And it was hard. I mean, we had customers on the board. We had, Kyle Ambassador was on the board from Signify. I mean, that guy, he's seen more software than all of us put together. And it was an amazing board. The team that was there, they added value. They pushed us hard. And I think your current board is pretty much similar to the one you had before. You want to talk about that a little bit?
Yeah. So it's been I would say a really enlightening process, both in going through board formation with Vistria in 2021 and then going through it now again in 2025. I do think one of the neat things about this board has been continuity. So we've had multiple people from our prior board continue to stay on our board, like yourself, obviously the Vistria group. Nick Lepricaro was our chair in the prior board with Vistria. He has continued to be our chair, new chapter. And, I think there is, especially in the first year of integration and merging, there is something to continuity at the board level. I think too, Berkshire's done a great job of bringing new people and voices and perspectives onto the group that we have today. There are several new board members who have been CEOs of other large software companies, one huge healthcare software company. And so I'll say, even just from my perspective, it is great to have other voices and other perspectives in that meeting. And then, that conversation at the board level who have been here and done this. And in general, I think this was true with the Vistria board. I think this is true with the Berkshire board too. In most cases, even when conversations are difficult or hard, they are done in a way that is intended to make the company better. So you really don't have any politicking or power happening. All of the conversations are really focused on, okay, what are we doing well? What are we not doing well? Where do we have an opportunity to improve? And so I think so far, so good. It's been great.
It's awesome. And it's tough. I mean, you're trying to make a lot of people happy, and you got customers on your board, you got big private equity guys on your board, you got really smart people all around you, and you got to run the day-to-day operations too, and you're doing a great job at it. What's been the reaction so far from the employees and like the customers, the partners, the providers, the payers? I know you've been on crazy amount of road shows. I don't know how many times you've been to Dallas and New York and Florida, and you're going out and seeing a lot of the customers. What are they saying? Are they excited for you, or what's going on?
Yeah, I would maybe talk about each of those groups a little bit differently. So start with the customers. My experience with customers and having this conversation was, I think, really both. One, oh man, like this makes a lot of sense. Got that a lot from customers when we were announcing this in March. And then two, a lot of excitement, especially around what the two companies could do together, because there were so many opportunities for the products and the platforms to work together. On the employee side, it's been a range of emotions. And I think that is true for any company who's going through a merger, right? I think on one hand, I think there is and has been genuine excitement around taking two great companies and bringing them together and working towards something bigger than what we could do on our own. And at the same time, like there are nerves, right? And nerves from everybody, because it was always going to change the way that we worked, the way that the new company operates, and humans, we're uncomfortable with change. And so that has definitely been a factor. I think it is great timing for our new name, releasing new mission, vision. I think it's a milestone for us to, I think, do a few things. One, celebrate what both Forcura and Medalogix were and the value that they created in the industry, the mission that each company set out to accomplish. I think everyone involved in either one of those companies or both of those companies is very proud of what both of those companies were and what we were able to accomplish. I think it is also a celebration of, okay, like those companies don't exist anymore. And so there's an element of finality to a lot of work that's happened to realize a lot of the results that have either been created and or customers that we've supported along the way. And so this is a bit of like a celebration of the endpoint of those. And also, of course, a celebration of like something that's brand new. And so one of the major reasons why we wanted to have a new name and that we didn't stay with Forcura or we didn't stay with Medalogix, even though the brand names were strong and had a lot of recognition. We didn't kind of, I would say uniformly at the leadership level, we really didn't want to keep the same name because we wanted to communicate to our customers, to the market, especially to our employees, hey, this is something new. It's bigger than what either company has been working on, and let's get on board and let's go.
Yeah, it's funny. I'm so glad you got a new name, because I was on a call with you a while back, and you were telling me about everybody was calling the company Nuco, and somebody actually asked the question, is that really the name of our company, Nuco?
Oh man, it was I know at least the leader who had shared that with us is now like, okay, we're never going to live that down, are we?
No.
But it was I will say though, like it was a cool moment because it just goes to show how much the employees at this company care. For as like silly as it is, like you had an employee who was kind of scratching their head and was concerned enough to go to their leader and say, "Can you help me understand, like, how did we land on Nuco? Like, how did that become the name?"
Yeah, I'm glad I'm glad. I don't like the us and them and all that. But when this thing releases and the next day it's us, not them. And so I think it'll be really cool that we're all, rowing in the same boat. And I know that's one of your core values you had at Medalogix for years was row together. And I think Mosai allows us to row together. Well, cool. Let's talk about you, Elliott. Tell us about your leadership journey. How did you get to Medalogix? Walk us through your career. I know you have a story about Nana. I have a story about Nana. We don't call them patients, we call them Nanas. Tell this industry your story.
Sure. So, man, where to start? So, I would say my initial plan coming out of college was I was going to be a psychologist. That was a terrible idea. And I lasted 2 semesters doing that. And I think I did one clinical like practicum with one patient. And I was like, yeah, no way. This is not for me. And so dropped out of masters. I was married. My wife, at that point we're like 6 months into marriage and she's like, great. So I've married a dropout. And so dropped out. And it took me a little while to really find my footing. And I got, just because of a friend, a job doing data entry at a healthcare tech company here in Nashville. And so I was literally entering data into salesforce.com for a company here, scrubbing their data. It was a pretty unbelievable career start because I was an intern of an intern. And my office in this building was the closet behind the receptionist desk. And it was probably the size of the desk that I'm sitting at right now, but they had managed to shove a desk into this little tiny closet where I sat and just entered in Salesforce data every day. And so, anyway, that was an amazing, I would say, experience because I really started working through that process with the marketing team. And this was at HealthStream. And so the marketing team at HealthStream kind of took me under their wing. I had a great boss there. I had 2 great bosses there. But on the marketing side, Luther Kale was a great boss who I would say was just incredibly innovative, understood what data could do in the context of marketing. And that's really how I started my career, was as a database marketer for this company. So I did marketing, I did product management. I was at HealthStream for several years. Then I went to a company called Airstrip, which is still around today. It's based in Texas. And I had an amazing experience at Airstrip. I think Airstrip had one of the coolest products that I've ever seen. It was when the mobility boom was happening. The iPhone had just come out and the company had developed and had patents on like sending waveforms from the hospital to the physician so that the physician could see their patients and their waveforms in real time. And this was, again, when the iPhone's coming out. And so we were on Apple commercials. We were on the worldwide developer stage at Apple. The product was amazing. And we really struggled as a business. And so I had an amazing kind of front row seat, active opportunity to see all of the good things that that company did, but then also some of the things that I would see and think, okay, we're not going to do that. I'm not going to do that in the future. Just an incredible learning experience for me. And so I was at Airstrip and I had a friend who I was trying to hire from HealthStream actually turned me down. He turned me down to go work for another startup in Nashville, this little tiny data science home health company. And a few weeks later, he called me. He was like, hey, you've got to come check this out. I remember walking into the offices in Nashville, and I'd say the offices, it was an attic of a house. And there with basically like 2 bedrooms upstairs, 1 bathroom, which was like obviously like great co-ed situation. So there were 5 of us in that space at the time and just fell in love with the team, what they were doing. I didn't know anything about home health, but what I think is like, it was such a cool opportunity for me because, at least as a company at that point in time, Medalogix had built pretty innovative, like I would say for the time, this is like 2013, right? Most people are just looking at like BI dashboard stuff. Not many people had ever seen a predictive model before. And so they had built this predictive model, and the product was like one screen. And so you would have these clinicians logging into a screen, one screen, with a risk stratification, and you would have the name of the patient, and it wasn't really ranked 1, 2, 3, 4, 5 all the way down. It literally had the probability of hospitalization like 0.275, and it just went on forever. So that was the first iteration of the product. And what I remember from that is the clinicians would log in, they would take a look at this thing, and they would be like, "Oh, that's really cool. What the hell do I do with this?" So I would say, for me, having worked in marketing, but then also most of my career in product, it was just a cool opportunity to come in with a very innovative group. And really, my role was, okay, you've got an unbelievable technology here. It certainly should fill a problem or solve a problem for our customers. But how do we commercialize this? What is the actual value that this is creating? And I would say one of the common threads in my startup experiences, first with Airstrip and then here at Medalogix, is I think you guys at Muse did this almost immediately, is like the first thing you have to do outside of just creating really cool technology is genuinely, deeply understand what problem or pain is this solving for the customer. Because if it's not, then it's just going to cause more complexity, more problems, more work for them.
That's right. That's right.
And so I would say very early on at Medalogix, our DNA became, oh, we can't just create a predictive model and throw that over the fence or put a risk score and UI for a patient. Or for a clinician, we have to be very thoughtful around what the software is, what the clinician does with that, and how does that lead to some sort of value. And then over time, I would say what we realized, to make it even more complicated, is that value can and should be clinical. It should be creating value for the patient, but somewhere it's got to show up in the finances too. And so again, I think part of the DNA in Medalogix, I know this was the case in Muse, this was certainly our thought process when we came together as a team, was, okay, we have to ensure that whatever we're developing is, one, going to be usable, two, is going to create value for the patient, and three, at the end of the day, is going to make the CFO happy. And so that was early learning for us. That was 12 years ago. So it's been quite a journey from startup land. I would say, just to keep it brief, there have been plenty of ups and downs, and really good times and really difficult times where you're like, I'm not sure we're going to be a business tomorrow. And 12 years later, we've gone through the Medalogix and Muse merger in 2021. We had Vistria a group partner with us to do that. 4 years later, 2025, it's largely kind of the same process as before, where we're partnering with the Berkshire Group and bringing two, frankly, great companies together, Medalogix and Forcura.
Yep. So you got to quit saying Medalogix now pretty quickly.
Oh, thanks.
It's going to be hard. I know. 12
We're
years is
gonna
a
have to
long
get it,
time.
like, we're gonna have to get the jar, it's like cuss word jar. It's like anytime you say one of these, you're gonna owe $1.
Right. All right. Tell us an Nana story. So I know you have a really passionate Nana story. I've heard it before. I want this industry to hear it.
I have a new one. It's a good one. So I have, I think I'll take a step back even and say, one of the, I think, wonderful things about working in home health and hospice in general, but especially at Mosai, and what we're trying to accomplish with Mosai, really is help the patient get home, transition into home well, ensure that the clinician has what they need in order to make good decisions, so that ultimately the patient can stay home. And that is, both in home health, it's in hospice. And so we're all kind of driving towards the same outcome here, whether you're a Mosai customer or whether you're a Mosai or whether you're a Mosai partner. I do think that's one of the unique things about this industry broadly is there is such intentionality and focus on the patient and that core mission at the end of the day. And so it is a great leadership tool or instrument because the people that work for your company feel that too. Because most everyone in some capacity or at some point in their life have had a grandmother or a grandfather or a parent who has had some sort of event at the end of life, and how healthcare responds in that moment really makes or breaks that experience for them. And
For
so
sure.
I know that's your Nana story. I have multiple now Nana stories. So my last story I know that I've shared with you before is Ma. I actually have a Nana. And so this will be the first time I share my Nana story. So years ago, I say years ago, probably like actually it was like a year ago. I think she had an experience like a lot of people who are her age. So she's 89 now, and she fell, broke her hip, went to rehab, did the whole thing, got better, and then fell again and fractured her back. And, I remember it is this frankly terrible experience that we all go through with our grandparents, with our parents. You just start to see this pattern happen, and there's concern about them and their safety at home. And at the same time, the last thing that they want is to go back to the SNF or for sure not go back to the hospital. They don't want to live in assisted living. They want to be home, which is what my Nana wanted. There's a great book that we reference a lot here that is Being Mortal. We're actually reading that as a new leadership team here as Being Mortal to really understand the mission and kind of what's happening at the end of life for these patients. And something that he talks about, Atul Gawande talks about in this book is at the end of life, really the idea is about flourishing. One of the things that Atul Gawande talks about is certainly the broken parts of healthcare and how people at the end of life ultimately don't know what their options are, ultimately leads to instances like what my grandmother is experiencing where, they're going in and out of the hospital, and just how draining that is, not just for the patient, but for the entire family. And so we were living that. And man, there was just so much fear and concern, and I would say disagreement between the family around, okay, well, like, what do we do about this? And how do we help her? Ultimately, she just wanted to be home. She wanted to be independent. I remember her having this goal. So a big part of her motivation to go back to therapy again after she'd fractured her back was my cousin was getting married the next spring. So in March of the next year. And she was like, I'm going to be here and I'm going to walk down the aisle for that. That was the core motivation. We get to the wedding. She walks down the aisle. She does her whole, she gets to do what she wants to do. And then we go to the reception and, it's a big party, lots of music. Everybody's having a great time. And all of a sudden there's this kind of ruckus over at the table. We look over and Nana is like standing up. And, my family's running over there. They're, worried, like, what's happening? What does she need? And so I run up to her and she grabs me. She pulls me like close. She says, hey, everybody's so worried about me, but I just want to dance. And she's like, and I don't know how many more times I'm going to have the opportunity to just dance. And I think, part of what Atul Gawande is talking about in his book is, at the end of life, what we want is the opportunity to flourish. And I just thought about that moment with my Nana around, like, in that moment, she was flourishing. And, we were having to kind of hold her up while she was dancing, but she was dancing. And so that would not have happened without home health. And she went to a home health of one of our customers who would call me because they know me. And when we were dealing with some family stuff and decisions and how things needed to work, it was just a pretty incredible experience to have her go work with Compassus and know that Compassus cares enough to call me and make sure that they understand, okay, well, what is the family system here? How is this working? What is it that we're really trying to accomplish? And so she had Compassus. Compassus also coordinated personal care. And so on the days that they weren't going to be there, there was personal care that was there. And so, she went through multiple falls and multiple fractures to going to a wedding and dancing. And now, so she turns 90 next year, and she's already told everybody for her 90th party she wants to dance.
Dance party. You should do it. You should get somebody big to come in from Nashville. Yeah, that's awesome. That's a great story, and the recovery of that's amazing. And shout out to Laura Templeton and the Compassus team over there. Great job. That's totally cool. Thanks for sharing. Hey, send a link over to Cole on that book, and we'll post a copy on the podcast notes so people, if they want to read that book, and go get it. I've read that book before. It's actually an amazing one.
Being Mortal by Atul Gawande. It's incredible.
Yeah.
And it's at the heart of what we're doing for sure.
That's cool. All right. So both of these companies, the old two companies, now Mosai, had amazing trajectories. They both grew. They grew through technology sales. They have dominance in the customer base. They have dominance in the EMR space. What lessons are you from the growth of those companies are you going to carry forward? And is there something out there that you want to tell everybody about?
Man, so lessons learned are you can't take your eye off the ball of value ever. And, I think both of the companies were very good and intentional around, and I know I mentioned this earlier, in terms of understanding how information actually gets into workflow and use to impact an outcome. You can't ever take your eye off the ball in terms of how you're creating value for your customers. One, and then two, just because of the nature of, I think, the world today, but also being a technology company, you can't ever stop innovating. And so you always have to be moving forward and progressing and bringing new things to your customers to ensure that what they are working with is the latest and greatest capability so that they can be as efficient as possible and to create as good of outcomes as possible. And so, those are two, I think very simple ones. I would say in terms of related, exciting kind of new things on the horizon. There is a lot that this company is going to bring to market around, I would say, a combined offering from the time that a patient is referred into home health, then all the way through that patient journey while they're on home health, while they're on hospice. And I think it's pretty simple what we want to do. And, what we want to do with predictive modeling and machine learning and now generative AI, which is for real, already have multiple use cases in our products, which frankly just became a core part of a product that already existed. And so, I would say really aspiration number one for Mosai is we want to be the best clinical analytics partner solution company in home health and hospice. That is where, we want to be focused. We want to ensure that we're driving great outcomes and good software, great software to our customers. And we want to be the best at that, one. And then two, and this in large part is the Forcura piece of this. We want those clinical analytics to be connected, right? To be connected to the clinician in the field, to be connected to the physician who referred the patient or the upstream referral who referred the patient. Because we believe one of the challenges that our customers face today is that in large part, their partners, whether that is, facilities who are upstream or payers or physician groups that we're looking to partner with, in large part, those partners still do not have an understanding or an appreciation for what our customers do. And we believe, based on some of our work with Signify, actually, we believe that a huge part of that lack of understanding is primarily because there's a lack of visibility around what's happening. So when the patient goes home, if I'm a physician who's bearing risks and I send my patient home with a home health agency, I have no clue what happens. I don't know if it was timely care. I don't know what the plan of care was. I don't know if they're reserting that patient. The only thing I know is that I get a claim, 90 days to 6 months later, and it shows up as a cost line item for me while I'm trying to manage cost. What they don't know and what they don't see is everything our customers are doing to keep the patient out of the hospital, improve their stability, try to have more stories like my grandmother, where it was incredibly successful because of home health, and we were able to get this patient back to independent in the community. And I think our partners who are upstream and physicians and payers, a big part of our issue with the payers today is they don't fundamentally understand that. And so I think we believe that one of the roles that Mosai can play for our customers, with our customers, is to help them elevate that perspective and their stature in these partnerships. And we believe we have a unique capability to do that.
That's awesome. And I love that we're going to start calling Nana Dancing Nana. I think that's awesome.
She's Irish too. So she would be perfectly fine with that.
That's awesome. All right. How will the Mosai analytics platform, as well as the Mosai workforce solutions, formerly known as Forcura, how are you going to bring them together in a unified offering?
Yeah. So the way the products have existed today and how we commercialize those products, I would say despite being SaaS companies, two SaaS companies that in a lot of ways looked very similar, the way that we brought those companies to market, how we structured the offerings themselves were very different. And so we've had to go through a process of actually kind of distilling it back down to, okay, well, what are the unique capabilities that exist in each of these platforms? And as we're bringing these together, try to ensure that we're packaging them in a way that makes sense to the customer. Because I'm not sure that that's always been the case. And we're going to have multiple products across 3 lines of business. So the first kind of line or product family is referral and admissions. And so you will have the Forcura referral product that has existed today, but we're about to really supercharge that product with a lot of Medalogix data, with automation, with clinical and analytical capability. So there's about to be just a ton of new value in that product specifically because of all the work that we're doing now to bring these two companies together. We're trying to make that referral process and that referral and admissions family as hands-free as possible. Because one of the things that our customers have said very loud and very clear is we want to touch as few pieces of software as possible. We just need this to happen. And so what we're working toward on the referral side is, okay, well, let's make this as hands-free as possible. How much, between AI and between automation, how much can we really automate? Let's go push the envelope there. And so a lot of work is going into that product, and we're excited to release some things in the next couple of months. There will be a hands-free exchange from the information that is going into and through Forcura into what is going to be called the review product. So the review product was formerly known as Pulse Referrals and Admissions, which doesn't make sense anymore because we have now merged with an actual referral company. So this product is going to be called Review, and there's going to be this hands-free capability, automation, for these referrals that are being processed through Forcura and into this review product, such that the customer can get a notification around which patients have conflicts in their OASIS and or inappropriate or wrong coding and or missed comorbidity on their documentation. And so that will work whether you have your coding and your OASIS insourced or whether you're outsourcing it. So because it's hands-free, a customer will be able to take advantage of this, whether they're doing it on their own or whether they've outsourced it to a vendor. Then we have our clinical management family. And so our clinical management family is the legacy Medalogix products. That is Pulse, which is episode management. That is transitions. That is home health to hospice management, and Muse, which is utilization in hospice and ensuring that people are getting the right amount of visits in the last week of their life. Then we have our network care solutions, which is family number 3. And so the network care solutions will be the legacy Forcura orders management platform and the connectivity that we call Circle with the physicians. And so we have over 400,000 physicians today who are signing orders that are coming through Forcura. So one of our big focuses is trying to eliminate a lot of that faxing that's going to them and have physicians sign up on what is essentially like a free platform for the physician to review and sign those orders digitally. And then if you take a step back, now you have all of these assets here between these 3 product families. And if you have as a customer, if you're working with any of these products, if you have any of these products turned on, the assets in a particular product will start to show up as information in the other products that you have. So, as an example, if you're a physician and you're signing orders with a customer who also has Pulse, one day you're going to be able to see what is the risk of hospitalization, what is the utilization that's planned, has there been a significant change in condition, if they're planning to reinsert the patient, then why? Again, going back to what we were saying earlier, like we believe a big part of like the role that we can play is today that physician's largely blind to what's happening in home health. Well, this is like the conduit to solve that problem. Another example would be in our referrals product that is the legacy Forcura referral management product. We are migrating a lot of the clinical information that we were focused on and capturing in Medalogix to Forcura and that referral management platform. And so our view is that isn't really a document management platform anymore. That is the beginning of the clinical experience for our customer with these patients. And then the last thing is, this is a cool one that we're really excited about. Forcura has a mobile app. Medalogix has never had a mobile app. And the Forcura mobile app has been broadly deployed for that onboarding experience for the patient. And so, we are imagining a day where if you have Pulse or Muse or transitions and you also have mobile capability, well, now you don't have to pay for anything extra. That mobile, like that clinical analytics and clinical management capability just shows up on your app. And so one of the things that we've been looking for a long time is how do we get this clinical information into the field and into the actual clinicians' hands who are taking care of the patients at the bedside. And so we now have a conduit to do that in a way that neither company on their own really did before. There will be a lot of those use cases that we get to take advantage of over the course of the next couple of years. And honestly, it's really exciting.
That's really cool. I'm super excited about that too. When we built Muse way back in the day, everybody said, get this to my clinician in the field.
Yeah.
Get it to them. And it's always been hard to do that, right? Because they're on an Android tablet. We didn't have a mobile app. They didn't want to log into multiple mobile apps. But I think Forcura's done a good job. And they're already logging into Forcura's app. And they're already scanning, ID cards and consent forms and medications and all these kind of things. And so being able to have that clinical documentation at the hands of the bedside of a nurse who's trying to figure out, do I want to research or discharge this patient? And historically, research and discharge were based on the number of interventions and goals, but didn't have a falls risk assessment. It didn't have a rehospitalization risk assessment. It didn't have all those things. And so we're not trying to take away the nurse's capabilities. We're just trying to give them more data easily to find. And honestly, Elliott, we built these companies during COVID for the most part. And the challenge is, back in the old days, we always had continuity. The starter care nurse was the second nurse, third nurse, fourth nurse.
Yeah.
She did all the visits. And now we just need a nurse, right? And we're trying to figure this out. And that's all changed. So I've never seen that patient before. Do I go into the Android tablet and try to read the entire medical record? And I think some of the stuff you're building and being able to share between Medalogix and Forcura or now Mosai is How do I make that easy for the nurse to be able to see what happened to that patient? How many visits do we do? How many orders need to be signed and all that? So that's super exciting. On the Circle product that you were talking about, I want to make sure the listeners understand what a problem this is. Most agencies have millions of dollars that are locked up in orders. They're trying to get a doctor to sign orders. I've had my butt chewed so many times over the years because we faxed and refaxed again. I'm trying to get the doctor to sign these orders. And he's like, every time I walk into my office, all I have is home health papers all over my fax machine. I can't get my labs done because you're faxing all these orders to me. And we built the automation to fax them. But I think with the Circle product, from what I understand from it, and correct me if I'm wrong, please, but I can sign not only my SNF orders, but my home health orders, hospice orders, even medication changes, all those things really easily in one click, review them and sign.
Yep.
And it's kind of like DocuSign when you're buying a house, you need to sign it 9,000 times.
Yep.
Doctors are in that scenario where they're buying a house every day. Essentially, they're just not spending any money on it because they're signing so many single forms. And so I'm really excited about where Circle's going to take us. That's a huge revenue lift for agencies. They're not going to get more revenue, but they're going to get revenue quicker.
Right.
And they actually will not have to write off as many adjustments because they couldn't get orders signed for timely filing. So super excited about that.
Yeah. So just to even share, so this was a story. We were the customer this week. It is today, October 2025. And you still have physicians who are insisting on hand-delivered orders. That's a real thing. Like, they're not even just faxing it, but their frame of mind is still receiving a hand-delivered order in order to sign, and then to have that hand delivered back to the agency. Like, it is their preference to hand receive an order from the agency, pull it out, sign it with a pen, and then hand deliver it back to the agency. And so for all of the inefficiencies that our customers have to deal with anyway, the reality that is still the case, and you still have clinicians and physicians who are having to operate that way just to ensure that a patient receives care, was mind-blowing to me. This was a use case or like an issue that I learned about 7 months after we brought these companies together. It's like, it really is the dark ages still out there in some places in healthcare where, frankly, basic technology and an opportunity to route information in a digital way has the opportunity to create a ton of efficiency for them.
Sure. So every one of these home health and hospice agencies that we're working with, and SNFs, doctors, they all are on an EMR. How are you approaching interoperability? How are we getting data in and out of these EMRs? And what's your vision on that?
Yeah, so we have a long list of partners just with Mosai now, between what Forcura had developed over the years and what Medalogix has developed over the years. So we work very intentionally with our EMR partners. One, because we believe the same as, 13 years ago when you and I were working together, it's still important for the EMR and for solutions like Mosai to be connected, to reduce data entry as much as possible. And so, the ability to receive data in near real time from the EMR is important. The ability to push documentation back into the EMR that's occurred in Mosai or any of Mosai's products, because the EMR is the system of record. The ability to push that back and not force a clinician to like double enter anything is very important. So we have spent a lot of time really thinking through what those connections need to be. Like I mentioned, we have a bunch of EMR partners across our platform, and in general, our approach is to be very intentional with them and ensure that there's really good alignment in our partnership and that we're both working towards creating a lot of value for our mutual customer.
That's awesome. All right, let's jump into ROI a little bit. You know me, I'm always like, let's add a lot of value to the customer. Let's make sure that the products that we're building add value to the customer and pay for themselves. How are you going to take these two products together now under Mosai? And how do you ensure you're creating ROI? And what are you doing to test that? And then what are you doing to ensure that ROI is being delivered?
Sure. So I said, I think earlier in the podcast, right? Like, you got to make sure that this information is usable. You got to make sure that they're adopting it, and you got to make sure that it's impacting outcomes in a way that isn't just clinically appropriate, but is also making the CFO happy. And so we spend a lot of time in implementation working with the customers, no matter what the product is, to understand what the technology is and training. That stuff is easy, right? What the product is in training is like table stakes, easy stuff, because these products aren't really complicated. What is more complicated and requires more work with the agency as a partner is the change management effort along the way, and ensuring that the leadership team is involved and that they're casting good vision for their teams around, hey, this is why we're adopting this product and how it's supporting our mission as a home health agency to provide better care for the patient. Just like any technology endeavor, it really starts with leadership at the customer. What we want to do is make sure that we are hyper aligned with the leadership of the customer as we're going into that implementation and then throughout the life cycle of like our work with that customer. And so one is ensuring that there's good leadership in play. Two is helping them with change management and then helping them track that change management in the context of adoption. The other thing that we have to do as a solutions provider is not just provide the base capability of the product that the user uses, but across the platform, we also provide a ton of information around one, how the product is being used and where it's not being used, but it should be. And then two, when it is used appropriately, how is that impacting your patients and their outcomes and your business financially? One of the benefits of being a data science company and having a deep relationship with the EMR and getting the amount of data that we get is not only can we provide the base offering, but we also know what happened to the patient and we can see those outcomes in the data. Just as a part of the product and its core offering, having those analytics and that visibility provided back to the executives and the customer leadership is key.
Yeah, I think one of the interesting things is we built, Medalogix and Pulse episodes and transitions is being able to see that holistic patient over time.
Yes.
If a patient lasts 120 days or 150 days on hospice or multiple episodes on home health, in all the EMRs, most of the models are you have to look at each episode or each benefit period to figure out what's going on. And I think it's really cool how Medalogix built the ability to see a patient 365 days and what was going on with that patient and where was their trajectory and were they on home health and they were on transitions and they were into hospice and they passed away and being able to track that all the way through is, they kind of the longitudinal line of technology is there, right? It's easily to do it. We solved it. All right, let's jump into AI. And everybody calls this artificial intelligence. And I'm trying to get away from the word artificial because I don't think what we do is artificial. And I don't know why they named it artificial intelligence back in the day. Somebody way smarter than me did that. But what we're doing is not artificial. It's real intelligence. It's just technology-enabled intelligence. But talk to me a little bit about Muse, Medalogix. These guys were the first ones to really come into predictive modeling and neural nets and data science. And nobody else was doing that back when we started this. And now everybody's doing it, right? Everybody's talking about AI and generative AI and large language models and all that stuff. But what's the roadmap? Where do you see this thing going? I know you and I talk all the time about this, but I want the audience to hear it.
Yeah. And so broadly, I would talk about 3 different categories. I did a presentation for a group last week where I outlined these differences as well. So you have business intelligence, you have predictive modeling and data science, and you have what is now large language models. So what people are calling AI, right? Quote unquote, Gen AI. Those are really large language models that generate content, right? So Gen AI. Like the differences between these is something that we do in our Pulse product, where we use all 3 of these types of analytics. So on the business intelligence side, the most basic thing is understanding how your business is performing over time. So let's use recert rates as an example, or the idea of a recertification. So as an agency, I might want to know my history of my recertification rates and what types of research I'm doing across what different types of payers and maybe different ways to cut that to better understand my business, right? Business intelligence.
Sure.
I might want to understand in the context of peers, as well. Like, how do I benchmark myself against other companies who look like me? That is different than data science and predictive modeling, which is what is the probability that this patient is going to research? Or, like, for example, in our Pulse product, we are providing a prediction around the probability of research all the way through the episode, so that at the end of the episode, a user and a clinician can go in and look at, okay, this patient is probable to go back to the hospital in the next 14 days. We should probably do a deeper evaluation as to whether or not we should keep them on census and research them. Are they clinically eligible? Generative AI, large language models, are great at reading all of your information about the patient throughout the course of the episode and then coming back with a summary around, okay, if you were to research this patient, here is how this patient does or does not meet eligibility criteria for an additional research. I think Mosai's philosophy is you're still going to need all of these disciplines, right? So generative AI doesn't necessarily remove the need to be good at data science and have models that predict outcomes and really working to get that information into the hands of a clinician to make decisions. What we believe is that the two really augment each other. And so the ability to understand what is likely to happen with a patient and then provide additional context around a decision that they need to make, we think is going to be a unique differentiator for Mosai and what we're able to do. So our intention is, with AI and kind of roadmap, to really look at all of the different places where, when we're making a prediction, like research as an example, a patient is likely to die as an example. In all of those cases, we're making a prediction, and what's happening is today, or historically, a clinician has seen that in the application, and it's then forced them to go do additional research to then make a determination around what they should do. What we want to do is continue to make that prediction so that the clinician has it, and then do that research for them. So we can tell them, okay, this patient, it's not that they're just likely to pass away, but you don't have to go do research in your EMR anymore. Here is the clinical justification or clinical eligibility for that patient to move to hospice.
Let me simplify that a little bit in the way I think about it. So in today's world, Medalogix historically would predict that this patient's high risk for hospitalization or high risk for, or should be researched or discharged. And so it would say research the patient. And some clinician, clinical supervisor in the back office would then go pull up all the clinical notes in there, read all those notes, try to find all the reasons why we should go back to the doctor and say, doctor, we need to give Nana more time on service. If we discharge her, she's going to go back to the hospital.
That's
she
right.
has a wound. She's got a medication she can't manage. She's, got stability problems, or, all the social determinants, all that. So what you're saying today is that LLMs, the large language models, are able to go read that entire medical record and not make the decision for the nurse. It's going to say, hey, we highly recommend you research this patient. And here's the 42 things or 3 things of the reasons why we think you should research this patient. So I no longer have to log into the EMR and go look at every single visit, go track the vital signs, go look at their medication, go look at their orders, go look at their wounds, go look at their therapy notes to figure all that out. That's pretty cool, Elliott. So that's what that's going to say is, instead of me having to go study all these patients, and I should know my patients pretty well, but if I have 300 patients in a branch and it's day 55 of an episode, I'm going to research that patient. You're going to feed me all that information using the large language model to summarize it for me. Why would I not read the Cliff Notes? Why would I read the book?
Exactly. Yeah, exactly. And so you said this in your description, and I want to reemphasize it. You're not taking the clinician out of the loop. The clinician is still in the loop. They are still seeing the predictive model. They now have the Cliff Notes that are the justification for hospice or the justification for recertification. But now they don't have to go do digging in the EMR to find it. 1, 2, if something is missing, well, now they know it's missing, right? And so they know, okay, well, this is actually the thing that the large language model didn't find. That's the homework I have to do as a clinician in order to go finalize this eligibility assessment. Then the last thing is it's also writing the justification for you that should then live in the EMR to protect our customers when it comes to compliance. Because one of the biggest areas of excitement from like clinical leadership when we've shown them these capabilities is they've said, "Oh man, we've never seen a justification note like this before." Right? It is thorough and it cites. It doesn't just write the summary, but it will cite where it found that information on what visit from what day. So if there are ever any questions about that in the future, everybody can go find the information.
Yeah, it's no different than all the large language models now giving you the source of where it found the data. If you're looking on the internet, if you're using ChatGPT or whatever. So we're going to give you back the source, click the button, and right here's the page that it was. And by the way, from what I understand, you're doing that on the referral form. You're doing that in the Oasis. You're doing it on every single visit. You're doing it on med sheets. Any document that gets passed through the historical Forcura document management tools into what we now call, what'd you call it? What was the name of that product? Review. Through review. Yeah. Sorry, I was going to call it RNA, but
we'll get the cuss jar out. So we'll have the cuss jar out for that
one. But so really all we're trying to do is make that. And by the way, I think, and I would love to be challenged, and anybody can make comments on this. One of the hardest jobs, maybe going to see a patient pass away in hospice is probably the hardest job by far. But I think one of the hardest jobs in home health and hospice is that clinical manager role where they got to make that really hard decision. They got to make that justification. They get their paper graded. They're trying to figure out, how do I make sure that we're discharging Nana to the most appropriate place, whether it's home by herself or to another hospice or to a recertification on home health. But if I'm just making that easy for you, why would I not? Why would you not use that tool? Especially if we can build it in a way that people trust it. It's got good data and we point you back to the source. And I know you and I spend a lot of time talking about this. Point me back to the source so I can easily be able to click on a button and have it go find page 63 of a 100-page document to tell me, hey, Nana has a history of falls. Nana has a history of medication problems. Nana has a wound. I see patients all the time in this industry that, a patient gets discharged and have a live wound, or patient gets discharged and they wanted to be able to walk 10 feet or toilet themselves or be able to get out of bed and they're still bedbound and we're discharging them.
Yeah.
And nobody's trying to do this on purpose, but having that clinical documentation and justification right there is perfect. And then being able to feed that to the physician. Hey, here's all the reasons why Nana is capable or should be in hospice. Here's the LCDs, and here's where Nana fits in that. Diagnosis codes, meds. She lives alone, her disaster status in case there's an emergency, how are we going to get her to ambulate, where is she at? All those things are available. That's really cool, Elliott. As a provider and, as a technologist, but also as an old PA and someone that took care of a lot of patients, that's really cool.
Yep.
That's really cool. I'm excited for you there. This is going long and I love it because I think it's really exciting. I got 3 more questions for you. What concrete outcomes, clinical and financial, should agency expect within the first year of adoption of these products?
Depends on what you're trying to solve. Right. There's your technology answer. No, I mean, what I'd say, generically speaking, is the adoption of generative AI is going to go through the same hype cycle that every other technology before it went through, right? In terms of there's so much hype in the market today around all these different use cases and different things that you can do. And the fundamentals of adopting a new technology will be overlooked because people are so excited about what it is. And so if you aren't very intentional around everything that I said before, right, which is, hey, this is something that's being driven by leadership and why. Here's the appropriate way that this capability should now be delivered to a clinician so that a clinician doesn't have to go do 2 or 3 or 4 other tasks just to get the generative AI answer. I think the world is going to go through that, right? The same way that we went through adopting predictive modeling, same way we went through adopting EMRs, right? It just is new technology that you have to learn how to adopt. I think, at least what we see, and even using it some internally, is if it's adopted appropriately, there is an immense amount of efficiency created for your client. So we talked about a couple of use cases earlier where they don't have to go do that research anymore. There's way higher value use of a clinician's time than going and digging through an EMR for old notes. And so you free those clinicians up almost immediately. That's one. I think two is, and by the way, I think that being number one in our industry is a huge deal because
For sure.
there aren't enough clinicians to do this work today. And so I think there is a promise that generative AI can deliver around making clinicians' lives much easier and more efficient. I think there are a couple, but I'll give you two that we're thinking about. One is efficiency. Two is, I do think the way that the industry processes its documentation, one, will be more efficient, like I described, but then two, should be more accurate. And so there is pretty, I would say still significant amount of errors in our OASIS today, in coding today, even for our customers who are outsourcing it to companies and paying a lot of money. And it's principally because reading a 100-page referral plus the OASIS plus the notes from the clinician is really an impossible thing for any human to do in a 24-hour turnaround time. Like, it just isn't going to happen. But it is a perfect use case for reconciling the accuracy of our documentation, which should improve like customer star scores, BBP, outcome scores, should increase reimbursement appropriately because that clinical documentation is there. So those are two that we see.
That's awesome. All right. Where do you see the biggest opportunities for consolidation or partnership with Mosai and the rest of this industry?
I think, one is we'll continue to partner with our EMRs and continue to look for ways to drive better integration, tighter use cases, more efficiency for the clinician. So, that's certainly one. Two is, I think there are a lot of great technologies that are coming into the space, whether it be Gen AI focused or whether it be telehealth has been something that the industry's been trying to figure out for a long time. And in general, our customers want to log into less places. And so, I think one of the partnership opportunities for Mosai is to continue to look for, whether it's telehealth or whether it's, other areas of episode management, other technologies that are impacting episode management and or clinical care. I think we would be interested in exploring those opportunities so those new technologies could be launched from the Mosai platform so that our customers can continue to have one or two workflow places to go.
For sure. And I'm a huge fan of the more consolidation you do, the more data we have, the more consolidation that we do, the faster we can go. Elliott, last question, and then we'll end the podcast. And I really appreciate you doing this. When it's all said and done, you're Mosai, you've bought other companies, you've rolled them in. I know you're trying to integrate these two right now. I'm sure there's going to be more acquisitions. When all that's said and done, what do you hope your legacy is? And then what do you hope the legacy of the company is?
I think for me, I would probably give the same two answers for both. My hope is the legacy for me, for Mosai, is that, at some point in time when the industry looks different, maybe Mosai is here, right? Like as its own entity, maybe it's partnered with other companies, who knows, right? But my hope is that people who were here in the industry while we were going through such a difficult time as an industry look back on the work that we do and hopefully the partner that we are to our customers, and that people think back about us as a partner who alleviated some of the burden of really what they're carrying in order to try to survive as an agency. And so that's my hope for like the company and the industry broadly. I would say for me and the company too, like my hope is probably similarly for the people who work at Mosai over the next year, 2 years, 5 years, whatever. They look back and they were like, oh man, my time at that company, it was special. And it was something that is hard to find. right? And so my hope is that we not only create that impact for our customers and alleviating their burden and that they will remember us that way, but then two, that we have a similar impact on our team and on our people, and that they look back at the end of their career and think, oh man, that's one of the best places I ever worked.
Yeah, I don't know if you listened to the April podcast, but it's one of the things she said, and on hers is she wanted to make every meeting, every interaction with every employee, something they'll never forget.
Meaningful. Yeah,
meaningful. And I think it's really cool. You've built an amazing team. I mean, with Derek and Laura and Rick and Stephanie and Mike and all the gang. I mean, everybody that I'm sure I left off 100 people that we should have named, but I mean, these guys all have passion. And I know I've been to your town halls before where we bring customers in and they speak to us and they tell us a story. And just like the story we're telling here about Dance and Nana, but it really is impactful. And I mean, I know Laura Breakotter, worked for me in Clara back in the day. And when I was on the board of Clara and she came over to this business, she said, I thought Clara was really cool. We were doing meaningful things. Man, what we do here at Mosai now or Medalogix is amazing. I know I talked to Annie, and Annie's like so passionate about how do we reduce workflow burden? How do we do those things? So you've built an amazing team. You're very blessed to have that. I know you can't do this by yourself, and that's super important. Well, Elliott, I really appreciate you coming on and sharing the new story, sharing the new name. It's super cool that, we get to be the ones that announce Mosai, the data intelligence, the AI, the document management, the transportation, the signing of orders. I mean, you're surrounding everything in home health and hospice, and you should be really proud of what you're doing. For our listeners, let's take a moment to reflect. How will we adapt? How will we innovate? And how will we partner in post-acute care? That's going to be really, really important for the ecosystem for tomorrow. This business is getting harder. Companies like Mosai are really trying to make it easier for your clinicians. And whether you're a clinician at the bedside or a leader navigating value-based care or a technologist looking to connect the dots, the future is coming fast. So if you need help, reach out to Mosai, get them at mosai.com, or you can send an email, I think, to sales@mosai.com, and that'll get right into the team. But we'd love to have you get a demo of these products. Really appreciate all you're doing. You guys are angels in this industry, and I'm super excited for you, Elliott. Congratulations.
Thanks, Tom. Thanks for having me.
You bet. All right. Talk to you soon.
See you, man. Bye.